Hi, everybody. I am Erin Mann. I am the Program Manager for the National Resource Center for Refugees, Immigrants, and Migrants. Thanks for joining us this afternoon for this webinar. I'm going to start with just a little bit of background about NRC RIM, and then I'll turn it over to our colleagues at the International Rescue Committee to take us from there. So a little bit of background about NRC RIM. We're funded by the CDC. We're housed at the University of Minnesota, but we're really fortunate to have a great group of partners, including the International Rescue Committee, working with us on this project. Our main goal is to support both health departments and community-based organizations that work with refugees, immigrants, and migrants with COVID-19 response. And some examples of the services and activities that we provide here at NRC RIM are health education materials, toolkits, and trainings like these. I wanted to highlight a couple of vaccine resources that can complement some of the content that you're going to hear today. The first of which is Vaccine Central. Vaccine Central is a section of the NRC RIM website that has a lot of different materials to help with vaccine confidence and uptake among refugees, immigrants, and migrants. We have things like vaccine event plans, talking points, frequently asked questions about the vaccine, and conversation guides. We have a lot of fact sheets with translations. And then we've also been collecting over 20 promising practices from around the country that highlight approaches and techniques for vaccine rollout among refugees, immigrants, and migrants. All right, I wanted to mention really quickly 3 of our customizable and translated campaigns that we're hoping folks on the line might be able to use when working with communities. The first of which is our Get Vaccinated campaign. The goal of this campaign is to create awareness about the COVID-19 vaccine. And the content is based on community feedback that emphasizing the importance of getting a vaccine to benefit your community really resonates pretty universally. So we have materials available in about 40 different languages, including posters and social media assets. And the materials are also customizable, so you can add your own logo, photo, and URL. We also have our Get the Facts campaign. And the goal of this campaign is really to create understanding. It's based on CDC guidance and has information about the vaccines, including information that might address common misconceptions or questions about the vaccine. This is also available in about 40 different languages, and it's also customizable. So again, you can add your own logo, swap out the photos, add a URL, and we have posters, fact sheets, social media, as well as audio-visual PSAs available. And then finally, our third campaign is Vaccination Is, and this is really focused on co-creating campaigns in partnership with target communities. And this is based on the understanding that unique communities really need unique approaches to COVID-19 vaccine confidence. So we have a series of campaigns that we're really proud of that were developed with 8 different communities based on their feedback. And to complement the Vaccination Is campaign, we have something called MakeSpace, which is an interactive website that just went through a redesign. So we're hoping that folks will check it out. And this allows people to customize vaccine messaging that meets the needs of local communities. And there's a lot of exercises, activities you can walk through to build that messaging. It also includes drag and drop templates and easy to use guides. And then finally, I wanted to mention one other vaccine related training. It's our Vaccine 101. This is available on our website. It's a short video presentation and covers information about COVID-19 vaccines, also to help you have conversations with clients and others about the vaccine. It includes a video and also a downloadable PowerPoint in case you wanted to deliver the content to a community group or to clients. So with that, I'm happy to introduce our speakers for today's webinar. So we have colleagues from the International Rescue Committee. I'll start with Sarah Clark. Sarah is a technical advisor for health promotion with IRC. She's a global health consultant who has worked with organizations in the United States, the Netherlands, United Kingdom, Canada, and Mali. She's also the coordinator for the Society of Refugee Healthcare Providers and co-organizer of the US North American Refugee Health Conference. Her most recent work includes program manager for a team investigating COVID-19 outbreaks in Southern Alberta's meatpacking plants through the University of Calgary's Refugee Health Research Program, Refugee Health YYC. Sarah has a Master of Science in Public Health from the Johns Hopkins Bloomberg School of Public Health and a certificate in Global Mental Health, Trauma and Recovery from the Harvard Program in Refugee Trauma. Next up is Lena Zara. Lena is a Project and Operations Senior Coordinator for the IRC. Lena is a Syrian-American social impact partnership strategist and bridge builder. She has a master's in international development and humanitarian emergencies from the London School of Economics and Political Science, with a specialization in highlighting issues and shifting the narrative for globally displaced persons uprooted due to humanitarian crises. She's worked with small to large scale nonprofits, NGOs, social justice coalitions, and government agencies like the World Food Programme, the International Rescue Committee UK, Quran Foundation, and the US Senate. And finally, Daniel Kaingo is a licensed social worker in the state of New Jersey. Daniel graduated from the State University of New Jersey with a master's in social work degree and is also a holder of an undergraduate degree in English literature from Pwani University in Kenya. He also holds a certificate in promoting child and adolescent well-being from Rutgers University. With more than 2 years of experience working in a variety of settings and with diverse clients, Daniel is currently working as a community health worker with the IRC Elizabeth office, specifically with Congolese refugee community members to address vaccine hesitancy, identifying barriers to vaccine access, and finding ways to help the community at large with vaccination campaigns. So with that, I'll turn it over to our speakers to take it from here.
Thank you, Erin, for hosting us today, and welcome to everyone who's on the webinar. So next slide, please. Thank you. So today, this is what we're hoping to cover. This webinar is really intended for any client-facing staff members, regardless of your specialty or your comfort level with health-related topics. And our goal is that by the end of this discussion, you'll feel better equipped to answer questions about the COVID vaccine, particularly any questions about the COVID vaccine for children, in a way that you feel fits comfortably within the scope of your role, while also honoring clients' dignity and autonomy. Next slide, please. We're hoping that you'll chat with us today. So we wanted to give you a minute for you to quickly type into the chat box just one word or a few words about how do you feel, honestly, when a client asks you a question related to the COVID vaccine, either for adults or children. And I'll give you all a moment to chat. Optimistic, Arlene says. I like that. Unsure. There are lots of people who aren't sure. Excited. Pressure. It can be a lot of pressure. Nervous. Fine. Overwhelming. Yes, it can be overwhelming to have to answer all these questions. Any other thoughts? Excited, encouraged, confusing, eager, cautious, okay, and hopeful. A sense of responsibility. Yes, it can feel like a big responsibility to be the one answering these questions. More excited, anxious, good. So thank you for sharing that. You're definitely not alone. That's what we're hearing a lot from our case managers too, in terms of it's a whole wide range of feelings, from being really excited that you're able to answer these questions and that clients feel safe asking you to. It can feel like a huge a weight on your shoulders to try to answer carefully, especially with all the changing guidance and updates. And so we're hoping that by the end of this training, that any of you who responded as feeling nervous or uncertain will feel more equipped to field these kinds of questions. And that for those of you who are excited or feel fine, that you'll pick up some tips that you can use. Next slide, please. So everyone, including within the general population, I'm sure you've heard from friends and family too, like everyone has lots of questions still about the COVID vaccine. And it's understandable that clients are also asking us when they meet with us. And we've heard from our IRC staff particularly that many feel unsure about how to respond because COVID vaccines are relatively new still. And then especially for kids, they're new since it just recently kids became eligible and only of a certain age group. There hasn't been as much in-depth training on the vaccine, and health-related issues might be outside their normal scope of case management. And then on top of that, the pandemic continues to be very dynamic. The guidance and information changes often daily. And even for people with public health backgrounds, it's difficult to keep up with the updates, such as updated guidance around mask wearing or what's going on locally. And RCRIM has these really helpful conversation guides available on their website, which you might find useful, and we can put a link in the chat. They're designed to help client-facing staff confidently and competently respond to the most common vaccine questions that we're hearing directly from clients. There are specific guides for questions about the pediatric vaccine and also the Delta variant, because we're starting to hear a lot about the Delta variant. Because it lives on the NRC-RIM website, it means we're updating it as the COVID situation changes, and so you don't have to keep as apprised of all the updates because we try to do that for you. So I really encourage you to take a closer look and even bookmark this page so you can refer to it during client meetings. And when you're responding to clients' questions, don't tweak the essential facts that we have in the conversation guides, but you can feel free to adjust the words to better fit your tone and the way you speak, because I know it's really important for you to feel authentic as you're talking to clients. Next slide, please. Before considering techniques for responding to clients' vaccine questions, we always like to center the conversation around the fact that refugees and other forcibly displaced people, they may have lived experience or a family history that includes medical experimentation or unethical medical practice or research. And this is also unfortunately true for many people of color in the United States. And sadly, there are many examples that I won't go into too much detail about, but one is there's the pharmaceutical experimentation, especially in the global South. There's the Tuskegee experimentation, which focused on African Americans beginning in 1932. And then the US has also been sterilizing Native Americans and African Americans as recently as the late 1970s against their consent. And then for some of our other client populations, such as the Ukrainian client populations, there's a well-founded mistrust of the government. In addition to this context, there are certain negative influencers, and I'm sure you've seen these posts on social media. There are certain negative influencers who are intentionally trying to spread incorrect information to sow discord and distrust within communities. And so it's very understandable that clients might be distrustful of the COVID vaccine given this context that we're working in. And now with the pediatric vaccine, there's the added element of parents are having to make a decision about the vaccine for their children, and they feel they must weigh the risks of getting the vaccine or their child getting sick. And this can be a very heavy burden, and it can be more difficult for them to make a decision than if they're just trying to decide whether they want to get the vaccine for themselves. Next slide, please. No matter our roles when engaging with clients, in the context of COVID vaccines, we can respond to the concerns compassionately and with a goal to equip people to seek out accurate information from credible sources. We've developed this acronym in the hopes that it will help you, kind of think about how to frame your response to clients if they ask you a question about the vaccine and you're caught a little bit off guard. So the acronym is NORTH. N is for normalize. The emphasis throughout any conversation that you have with clients should be reassuring them that asking questions, feeling hesitant about the vaccine, that's all very normal. It's a normal approach for them to take. And it's actually quite positive that they're questioning and they're seeking out information to make their own decisions. What's key to your role is being that person to point them to the factual information so that they can make an informed decision for themselves and their families. O is for open-ended, and you'll see in our role play conversation later that while discussing the vaccine with clients, they might come to you and say, oh, I've heard that the vaccine changes your DNA. It can be really hard not to repeat that myth as you're responding to the client and say, oh, don't worry, it doesn't change your DNA. This can actually inadvertently reinforce the myth in a person's memory. We also don't tell clients the information that they have is wrong, as that can shut down communication and make them feel understandably defensive. Instead, repeat the facts as you know them, using our resource as a guide. And you can ask open-ended questions to learn more about where clients are coming from with these concerns. What misinformation are they hearing? What are they concerned about? R is for resources. And we appreciate, again, it can't be said enough that we all have so many different roles and different knowledge levels about COVID and the vaccine. So it's okay to direct clients to culturally and linguistically appropriate resources to give more details about certain topics, such as what the vaccine is made of or how does it work in the body, if you don't quite feel comfortable going into that level of detail. This also helps facilitate clients' self-learning. In the conversation guides on the NRC-RIM website, we list many resources, including those that are translated into key languages. And the NRC-RIM also has a library of many thousands of resources. T is for together. You can explain when you're meeting with clients that your role is not to tell them what to do, because sometimes clients will ask, well, what do you think I should do? It's not within your role, but what's in your role is to connect them with the accurate, trustworthy resources. And you can emphasize this many times in many different ways, that it's ultimately up to them to make the informed decision for themselves, and that they should feel safe bringing their questions to you so you can work together to go through what their concerns are. And then H is for honest. If you don't have an answer to their question, you can tell them you don't know, and that you'll find that information and get back to them later. If you're comfortable, you can share your personal experiences with the vaccine and how you decided to get vaccinated, if you did decide to get vaccinated or have your children vaccinated. We keep hearing from clients that knowing someone personally who's gotten vaccinated sometimes makes all the difference in their comfort, and they decide to go get vaccinated too. Next slide, please. I'm going to turn it over to Daniel now, and he's going to share more about his experience talking with parents in New Jersey about their concerns.
Thank you, Sarah. Thank you, everyone, for joining us today. I'll give an example of our office and how we've been talking to parents about the pediatric vaccine. So we've been conducting surveys among the Arabic and Swahili parents, and this is both moms or mothers and fathers. And what we found from the survey is that parents were divided on whether or not to vaccinate their kids, and they have their reasons. So the ones that were for vaccinating their kids, they were of the opinion that is the best thing to do because the vaccine have been proven to be efficient and effective to protect children and adults, and it will be better if they vaccinate their kids, especially with schools reopening and camps and all that. And then we had parents who are still not comfortable vaccinating their children because they're saying there's so much that is unknown. And these are some of the things that you might be hearing once you start talking to parents about the pediatric vaccine. So long-term effects of vaccine on children. This was one thing that came up while we were doing the surveys, that parents are saying that there's so much that is unknown about the effects that the vaccine can have on their children, especially with puberty and fertility, because they're still young and they're growing. So parents were like, we're not sure, because studies have not been done to give us long-term effects on children. And then questions like, are vaccine going to be mandated for school, especially the coming school year and this fall? Those were also some questions that we got from the survey, and parents were asking if it's going to be mandated for vaccines for their kids to go back to school. With this question, I think it will depend. As of the moment in New Jersey, there's still no mandate. And like I said, it will depend on other states and how they're going to approach that. Another factor that the parents who were not for vaccinating their kids were talking about is there's very low statistics on cases of COVID-19 amongst children. And for that reason, they're saying, why should we vaccinate our kids? Because kids, from what we're seeing, they are not being infected as much. But we have to keep in mind when tackling these questions that there have cases of kids being contracting COVID and being hospitalized and eventually dying. And so when it is appropriate, while we're talking to these parents, we have to be able to tell them that there is a risk, even if it is small risk, but there is a risk that kids can get they can get COVID and they can be hospitalized and eventually die of COVID. If you guys have any questions concerning the survey and pediatric vaccine on parents, feel free to put them on the chat and we'll answer them later on our Q&A. I'll give it back to Sarah.
Thank you, Daniel. And yes, I would be curious to hear from participants what concerns they're hearing mostly from clients these days, especially around the pediatric vaccine, if you want to pop it into the chat. Next, we're going to move on to some practice of how to respond to some of these common questions. Daniel and Lena are going to role play a conversation between a case manager and a client. We'll pause throughout the role play to review the techniques Daniel is using as he speaks with Lena. The beginning of the conversation is going to address 2 questions. Next slide, please. So the beginning of the conversation will address this first question. And while you listen to the role play, please type in the chat, what concerns might you have in answering this question if a client came to you?
Thank you, Sarah. Thank you for meeting with me today. I know we don't normally talk about health together, but all case managers at our office are taking a few minutes to check in with clients to see if they have any questions about COVID-19 vaccine.
Yes, thank you. I do have some questions about the vaccine. I've heard fewer people are getting COVID in the US and that COVID is over. Do my children and I still need to get the vaccine? I'm just not really sure we need it.
That's a really great question, and I'm so glad you asked. There's a lot of information going around, and it's important to look at accurate, trusted sources in order to make the best decision for you and your family. It's a personal choice. For me, I did choose to get the vaccine for myself and my children who are eligible at the moment. Getting vaccinated is the best way to protect yourself, your children, and other loved ones against COVID-19 and other variants. although the numbers, as you said, might be going down in some cases, people who are not vaccinated do not have the same protections from COVID-19 as people who are vaccinated. Almost all COVID-19 related hospitalization and deaths in the US are among unvaccinated people. In some areas, COVID-19 cases are still rising because not enough people have gotten the vaccine. What I know is that when enough people get the vaccine, we'll be able to see our families and friends again, and things will go back to a more normal life. Again, it is very important that everyone make the decision that is best for themselves, their family, and the community after knowing all the facts. I can share with you some fact-based resources that might help you and your family make that decision.
Next slide, please. In answering these questions, you might have heard that Daniel did not say you should get your child vaccinated. Instead, he demonstrated his role as a trusted source to point Lena to reputable resources. And he also felt comfortable sharing his personal experience. And he encouraged Lena several times to make the decision that's best for her and her family. Next slide.
I heard that most kids get only mild symptoms if they get COVID, and the vaccine is still too new for us to know what the long-term side effects are.
I can tell that you care a lot about your family and you want to gather the best information before you make a decision. If you don't mind me asking, what are some of the things that you've heard about long-term side effects?
So I saw this video on Facebook about a doctor basically explaining the vaccine and that it has harmful side effects like affecting kids' fertility, such as puberty. I'm just worried that it's not safe for my children.
I see. There's a lot of information about the COVID-19 vaccine. Some are factual and some are not true. So the most important thing for you is to go to sources that are reliable and that use studied scientific facts. Sometimes it is helpful that you talk to someone you trust, whom you know has accurate information. For example, a doctor or a nurse or a community health worker. Sadly, even though many children experience only mild symptoms, some children will become very ill and even die from COVID-19. Therefore, the vaccine is much safer than becoming infected. Unvaccinated children can also infect people around them, such as those with serious health conditions or the elderly. Therefore, vaccinating children helps keep themselves and vulnerable family members safe.
Next slide. It can be tricky countering misinformation without repeating it. However, as I noted previously, studies have shown that repeating the misinformation, even if you're trying to say it's not true, actually increases the chance that a person will remember the myth. Instead, Daniel asked an open-ended question, and he didn't repeat the myth, and he also didn't tell Lena that she's wrong. We've also heard from communities, from our case managers and our community members, that more emphasis needs to be placed on how, although rare, children can become very sick from COVID and even die. By understanding this, parents can make a more informed choice when they're trying to weigh the risk of vaccination versus the risk of COVID. We did want to note that you know your clients best, so bringing up the possible death of children might be triggering for certain clients, or you might not feel comfortable. So we wanted to acknowledge that and say, it's okay for you to tweak your messaging in a way that still communicates the facts while taking into account your and your clients' needs. Next slide.
So what side effects do children experience from the vaccine? I'm just really not sure about that.
While some children may experience no side effects at all after getting the vaccine, it is also normal to experience some mild side effects. These will include pain, redness, and swelling of the area where your child received the shot. And the reason why this happens is because your child body is building protection against the virus. Um, your child might also experience tiredness, headache, muscular pain, chills, fever, sometimes nausea. Just like adults, these side effects typically last 1 to 2 or 3 days at most, and are due to your child's body being building an immune response to the virus. It's not from the vaccine or the virus itself.
Okay, but what about the cases of heart issues in children? How can I take that risk for my children?
You're not alone in trying to weigh the decision of getting your child vaccinated. I hear that you want to make the best and safest decision for your children. In April of 2021, the CDC was made aware of increased cases of heart inflammation in adolescents and young adults after getting the Pfizer or the Moderna vaccine. These reports are rare and most have gone away quickly. The CDC is still investigating and there's close monitoring to identify any new cases. Also, the CDC continues to recommend COVID-19 vaccination for everyone 12 years and up, as the risk of getting sick and dying from COVID are far greater.
But how does the CDC know it's safe?
That's a good question. CDC, together with their scientists, have done careful studies which show that COVID-19 vaccines are safe for children in the approved age group and have met the US Food and Drug Administration, FDA, high scientific standards for safety, effectiveness, and manufacturing. In fact, over 328 million doses of COVID vaccine have been administered in the US to people 12 years and older from different ethnicity, ages, and health conditions. Beyond the careful studies, the vaccine continued to be monitored for safety more than any vaccine in the US history.
Next slide. Daniel lets Lena know that having questions or concerns is normal, and he practices empathetic listening, especially with her fear about side effects and safety, which is a really big concern we're hearing from clients. He also repeats himself, you might have noticed, and that's okay to repeat yourself when you're answering clients. The key is that he's reinforcing key messaging in slightly different ways. Next slide. For the next part of the conversation, please type in the chat, how would you approach this question about the Delta variant?
So earlier you mentioned variants. What's this Delta variant I keep hearing about? And will the vaccine actually protect me from it and also my children against the virus?
That's a very important question, and we've heard that from many clients. I am personally by no means an expert, so I've consulted the latest information from reputable sources, such as our local health department. What I know is COVID-19 is caused by a virus, and viruses are always changing. So when a big change happens, scientists call it a variant. Some variants disappear and never cause harm, while others can make a virus easier to spread, harder to treat, and even more deadly. When variants occur, scientists and experts monitor them closely. The Delta variant is one of the COVID-19 viruses that scientists are monitoring at the moment. This was first discovered in December of last year, 2020, and has now spread to more than 90 countries. The first case of the Delta variant was found in March 2021 in the US, and is the most common variant in the US at the moment. Experts are worried that the Delta variant has two main reasons why they're worried. First, it spreads much more easily between people. Right now, in fact, it is severely affecting US communities who are not vaccinated. And second part is that there is also concern that the Delta variant might cause more severe illness. Right now, scientists think that the COVID vaccine in the United States are effective against the Delta variant and other variants that have been discovered. Therefore, getting our entire community vaccinated is one way to prevent variants like Delta from developing and spreading.
So in this response, you saw that Daniel built up trust and he stayed within his knowledge base about the Delta variant. And he acknowledged that he's not an expert, and he explained that he's heard his information from reputable sources. Next slide, please. As Lena and Daniel continue their conversation, please go ahead and type in the chat what materials you might need to answer these questions.
I'm just honestly not sure. School starting soon. Is the COVID-19 vaccine mandatory for school? Do you know if my child will be able to attend school and after school activities with this? If they're not fully vaccinated, I'm just really not sure about this and would love to know more.
I'm not certain. We will need to contact your child's school to learn about their expectation for student vaccination. And if you need assistance with this, please let me know. What I do know is that unvaccinated children and teens are at risk of contracting COVID-19 in school and other social settings, including after-school activities, summer camps, parties, or other social events. So having your child vaccinated as soon as they are eligible will help prevent infections and spread of COVID-19, making it easier to safely reopen school.
And will my children still have to wear masks at school? I thought the CDC mentioned that we don't have to wear masks anymore.
Yeah, that is a good question too, and many people are asking right now, and I can see how it is confusing. The CDC experts update their guidance based on the current COVID situation. They are now recommending that due to increased cases and the Delta variant, everyone, including those who are vaccinated, should wear masks indoors, in public setting, if they live in a place with high COVID rates. Even in areas with low COVID cases, people may choose to wear masks to be extra cautious. Masks are also required while traveling and when someone is in healthcare settings. As for school, experts have advised that school should require all children to wear masks. It's tough for school to track who has been vaccinated and who hasn't. And also we have kids who are under 12 who are still not eligible for the vaccine. And there are those who also are immunocompromised who may never be able to get the vaccine. So by having all kids wear masks, it helps to protect everyone and will keep everyone safe so that our children can go back to school in person, which is so important for us as parents and for our kids.
Next slide, please. So Daniel, again, he's normalizing Lena's questions about masks, and he, through his non-judgmental response, is building trust, where you can tell that she feels safe bringing these concerns to him. He's up to date with the latest guidance too, which can be difficult to track. And if your office hasn't already, you might want to establish a person or multiple people who help track and share what the latest COVID guidance is nationally and then locally for your area. Next slide, please. This is the last part of the role play. And again, please feel free to type in the chat how you would respond to this question.
Thank you for answering all my questions so far, and you've really given me a lot to think about. So if I do decide to get my kids vaccinated, what vaccine should I choose?
That's a good question. All COVID-19 vaccines that are available in the US right now are safe, effective, and can prevent anyone from severe illness, hospitalization, and even death from COVID-19 and the variants like Delta. Therefore, when considering being vaccinated as an adult, the vaccine that is recommended is the one that is available to you. That can be Pfizer, Moderna, or the Johnson & Johnson. For children and teens that are under 18, they are eligible for the Pfizer vaccine only at this time. Did that address all of your questions? I'm happy to follow up with relevant resources in your language in any topics we discussed today.
Thank you. I would like some resources, please.
Next slide, please. So in that last section, Daniel was facilitating Lena's self-learning and autonomous decision-making by offering to share with her reputable resources in her preferred language. And he also shared some last facts, but still remained within his knowledge base as a non-clinician. Thank you, Daniel and Lena. Next slide.
All right, so just to kind of hopefully summarize essentially all the things that Daniel, Sarah, and I spoke about today, we just want to iterate some kind of key messages, key takeaways for you to be able to utilize in the best way for you in terms of engaging and fielding these different questions that might come up, whether it's speaking with clients or other individuals within this kind of concept of vaccine and COVID confidence. So a few things that we definitely want to emphasize is that it's, as you saw with the way that Daniel responded to many of the questions, it's definitely okay to repeat yourself. It's, you know, almost like saying it's okay to be a broken record and saying things in different ways, just as long is that we're finding a different way to say it, and ultimately, you know, you are staying within your comfort zone. So if a person, for example, says they don't believe it's safe, you can try repeating this in different ways about the vaccine being tested on tens of thousands of individuals. It's really ultimately your role to say to clients, there's a lot of information out there, some good and some bad. And it's important to go to trusted places to find information about the vaccine, and that you, as that conduit, can help guide individuals to obtaining those trusted and accurate information. So again, your role is to be that trusted source to point people in the right direction and to reputable resources. In terms of a few other kind of key components that we like to emphasize with this idea of information provision is that, as mentioned also within our role play, it's important to recognize, and it's okay that as client-facing staff, we might not be a vaccine experts, and it's not our job to convince individuals that they must or to get the vaccine. Ultimately, we want it to feel that individuals feel empowered on their own terms to kind of make that decision, based on the accurate, again, and trusted information that we provide individuals, so they can make the best decision for themselves and their families and then their kids. We're here to ultimately have that kind of safe space for individuals to understand and welcome questions and concerns, ultimately, capturing that vaccine confidence that we've mentioned a few times, whether it's validating those concerns, showing that it's okay and normal to have these concerns in order to continue to build that rapport and trust with our clients. And offering the capabilities to provide more information when we don't know the answer. And which leads me to my next point of kind of staying within kind of our scope of knowledge and role, recognizing that we are that, again, that trusted conduit, and we can provide those resources and maybe able to provide some context around our own experience if we feel inclined and comfortable in doing so. Again, ultimately affirming that agency and choice of the individual. It's their choice and their decision, and we really want to enforce really to provide that space throughout, that we are validating the agency and the dignity of the client. And then last but not least, this idea of kind of referrals. So being sure to indicate that you're more than happy to do that follow-up, to get those resources and information to the clients in order for them to make that decision. So now we've kind of come to a culmination of the training this session. I'm going to hand it over to Erin to help us facilitate any questions that you might have for a Q&A session.
Wonderful. Thanks, Lena, Sarah, and Daniel. That was a fascinating presentation. I love the role play. I think that's a really great way to show how some of those conversations can take place. So we have a couple of questions that have come in through the Q&A, and just a reminder, if you have questions, please feel free to send them in through the Q&A box at the bottom of your screen. So here's a question. This is an interesting one. What kind of advice can you give when one parent wants their child to get vaccinated and the other does not?
I have a few thoughts, but first I wondered if Daniel, since you're our resident case manager and social worker, if you had any thoughts first.
Sure. That's a tricky question. What I would say is try to provide resources to the parent that is hesitant at the moment. Try to ensure that they understand that vaccine is safe, effective, and it's the best bet against protecting the children from getting ill and eventually hospitalized from COVID.
I like that. Just to add a little bit, thinking back to how I would approach it, I think I would see, depending on my rapport and relationship with the clients, I would maybe meet with both parents or with the parent who's hesitant individually to try to explore, to kind of get to the bottom of what are their concerns particularly. And then, like Daniel said, it's directing them to those resources and facts to try to address the concerns. Lena, do you have anything to add?
Yeah, I just wanted to quickly add, kind of based off of what Sarah and Daniel have already touched upon, was this idea of really understanding the family dynamics. We definitely wouldn't want to have a family member, especially maybe the individual that might be hesitant, to feel like a decision is kind of going over kind of with their input by only speaking to one parent. So depending on the nature of the relationship that you have with the family, definitely having it as both parents kind of at least involved with understanding, hearing the facts, understanding what sorts of resources they can to make a decision collectively together. And also depending perhaps on the family and maybe any kind of understanding any kind of cultural nuances, understanding the phrasing in a way that also emphasizes this as a family unit and protecting the family. Oftentimes, depending on the family, there is that sense of this being done as a family togetherness and almost like a community togetherness. So kind of at your best judgment, but some things to maybe think about depending again on the nature that you have of the relationship that you have with the family and what you know about the family previously.
Wonderful. Thanks for those thoughts. Another question that just came in, I can actually answer this one. Someone asked, can we have access to the role play scripts? Absolutely. So probably tomorrow morning, we're going to send out a follow-up email that will have the slides, that will have the scripts, some links to the resources that I mentioned at the beginning. So I'm definitely happy to share all of those resources with everybody who's on the line today. All right, let me go to the next question. Let's see. Here's one. Clients have been asking why people who are vaccinated get COVID-19. And the main concern is that they don't take the vaccine because even though those who are vaccinated still get COVID-19. How can I respond to this question?
This is an excellent question that we're hearing a lot, and I'm hearing it from family and friends and neighbors too about, especially with people hearing that people are getting infected with the Delta variant. So my response would be just gently reminding them that for every vaccine, not just COVID vaccines, that there's a small chance that you can still be infected even after being fully vaccinated, because no vaccine is 100% effective in every person. And that means there will be a small number of people who will get COVID, even if they've had the vaccine. However, the key to emphasize with clients is that anyone who's been vaccinated and then gets infected with COVID, they are very, very unlikely to get seriously ill or be hospitalized, and it's extremely unlikely that they will die from COVID. So they can view it as a way of they're priming their bodies by getting the vaccine so that their body isn't taken by surprise. If they do get infected with COVID, their body is able to better fight and protect them. Daniel and Lena, I don't know if you have anything to add.
I think you captured it perfectly.
Yeah, really, I guess the only thing to add, or really just to emphasize there, really hit the nail on the head, is that it's understanding the impact and weighing the risks. We've heard this come up also in cases, for example, why you heard in the conversation, why do we wear masks? Well, there are different levels, let's say, of with the mask wearing, even different levels of flexibility, right? When you have that when you are vaccinated, you have that protection, and not to really compare, but in the case of potentially getting COVID, it's that idea that you're lessening that impact on yourself, on your families, and those around you. And it's just that one step closer into keeping everyone, including yourself, safe, even though, as Sarah mentioned, it's nothing is 100% guaranteed, but it's that taking that extra step to ensure that you are protecting yourself and those around you as much as possible.
Wonderful. Thanks for those thoughts. Another question here we have is related to religious concerns that some people may have. How would you respond to someone who says it is against their religion to alter anything about their body because they were perfectly made in God's image?
That's another very good question. For some of these, particularly when religion is involved, we like to engage with local faith leaders who can act as those messengers, because especially if you don't identify as the same religion as the client and the client knows that, it might not matter what you answer. In some ways, they want to hear from someone with authority from their religion. So you might offer to connect them with a religious faith leader who you know could talk to them about the vaccine and why the vaccine could fit within their religion. And NRC RIM did quite a bit about that around Ramadan, and having faith leaders talk about how the vaccine was appropriate and how it's halal. And Lena, do you want to talk more about that?
Yeah, sure. So definitely after the webinar, please check out the NRC RIM website for those Ramadan videos that that messaging definitely was very key. And although it's in this particular instance very specific to those within the Muslim community, we really wanted to emphasize these very, of course, common concerns about getting the vaccine during Ramadan when you're fasting from sunrise to sunset, and whether it's the injection itself or the possible side effects. And many of those concerns tie into this aspects of altering things in your body. Within Muslim communities as well, we've heard of the worry of any sort of change in DNA and infertility. So needless to say, it kind of all comes back to this idea that when thinking about what individuals in the community wanted to hear and who they valued as that trusted messenger, we consulted local imams, trusted recognizable figures, as well as Muslim physicians to provide that messaging and address those concerns about the feasibility of getting the vaccine itself, the act itself, during a month of Ramadan, and addressing those kind of key points I mentioned. So it most certainly ties into what we share, but kind of who is sending that message, as Sarah mentioned, I think is very, very key, just to kind of reiterate and calm any sort of fear, apprehension, rightfully so, as for religious reasoning, wanting to ensure that, they're abiding kind of by every sort of practice, and especially in these very critical moments of the year, times of the year, such as Ramadan.
And then again, if you feel comfortable and if it's appropriate, we had one participant write that they will also share their personal opinion about why maybe they do feel like the vaccine fits within their religion and what they think God would want for them. Daniel, I don't know if you have anything to add.
Yeah, just basing your conversation towards leaders in the church, I think would be helpful, because most clients or most people will love to hear from people who they can trust. And I have an example. When I was doing a focus group with the community, there is religion came into place, and this particular client said that their elder in the church had given them a go-ahead to get a vaccine because they had proven that there is no fetal tissue in the vaccine, and also there's no any traces of blood in the vaccine, because with their religion you cannot add anything in your body, even blood. They don't do blood transfusion. And once the leader said that it is okay because the vaccine does not have those things, then they were able to come and go ahead and get the vaccine. So if we involve people who are of power in the community, people that they can trust, I think that's the best way to go.
Great, thanks for all those thoughts. We've been hearing at NRC RIM a lot about religious concerns, so it's really helpful to hear that rich discussion. Another question from the group: what advice do you give to those who have a lot of medical conditions and are worried about it interfering with their medications, or whether it will exacerbate their existing conditions?
Mm-hmm. That's another great question that case managers are bringing up. For things like underlying medical conditions and worried about interactions with medications, like that's a point to know that when it's not within your knowledge base, and to help connect them with a healthcare provider who could answer those questions. So you could just validate their concerns and say, yes, the CDC has put out some guidance about underlying medical conditions, and it's always best to check with your healthcare provider if you're concerned about that, because they know your health best. and they know about the specifics about the vaccine.
Wonderful. Thanks, Sarah. Another question here is, how can I talk with a parent that has a child with special needs and is unsure about the vaccine for their child?
That again, I would take a similar approach to the medical conditions of trying to understand better what are the special needs of their child, and then have they talked about this with their healthcare professional, just in the interest of staying within my knowledge base. And then also just trying to see what exactly are they concerned about. Is it with side effects or long-term effects? Is there anything you can help answer based on what you do know about the vaccine, like from our resource guide about the short-term side effects and the safety and the monitoring, and then direct them to their healthcare provider for their specific situation with special needs. Daniel and Lena, do you have anything to add?
I think you captured it well on my end, Sarah.
Wonderful. Thanks for all those thoughts. That question I actually encountered personally and with my family, and a family friend who had a similar question, and she was particularly concerned about bringing her child to one of the larger vaccine events. And so I put her in touch with a public health nurse from the local health department who was incredibly helpful and kind, and figured out a solution so that her child could get vaccinated in a much more comfortable location. So I think the local public health, including public health nurses, can be just a fantastic resource for sorting out some of those sorts of circumstances. All right, another question here is, many clients admit getting their information from social media. How do you direct clients to social media campaigns that are trustful? And then a follow-up, which I can answer, what is NRC RIM doing for social media campaigns? So maybe I'll just say briefly that NRC RIM, we do have a small social media presence. We're active on Twitter and Facebook. Our audience ultimately are health departments and community-based organizations, and we recognize that we're not typically directly the trusted messenger to communities. So we have resources that are intended to be helpful to those health departments and CBOs to then take and use, for example, some of the translated materials. So we don't have a particularly active campaign directed towards communities on social media. But what do our panelists think about that question in terms of getting people connected to trustworthy social media information?
Yeah, this is a really good question, and it's something that IRC is grappling with too. I would say, so speaking from the IRC context, some of our local offices have very robust social media presences where they post about COVID in different languages. So I would direct clients to, if your organization has a social media page that's client facing. It's also a matter of helping people wade through, especially if they're new to the US, they might not be familiar with the different entities of who's considered trusted versus who's not. So you might help them by providing a list if they're interested, of saying, oh, you could check out this organization and this organization and this organization, and they have trusted materials. Of course, one issue you're going to run into is not all of those organizations necessarily have social media posts in the right languages. And so that's something that IRC is trying to work on now, is creating like a community facing platform on social media where clients could come in different languages and ask their questions. And yes, Charlotte just sent me a note that social media is also not always updated, and that's correct. Like, organizations don't always have the best way to keep updated. Daniel, I'd be interested to know, in the New Jersey context, do you ever try to redirect people to different social media platforms, or do you tend to stay away from that?
That's a good question. So the New Jersey office, at the moment, we don't have social media. presence. What we do with case managers, they just use WhatsApp. So cases that clients ask questions, mostly is through WhatsApp, and we share resources from NRC, RIM, and other organizations that we know they're trusted. We share through WhatsApp to our clients, but we don't have social media at the moment. We try to get HQ to approve some, but the process has been a little bit hard.
Another thought I have is if you don't immediately have social media campaigns you can point people towards, you can equip them with the skills to realize if the posts they're reading are reputable or not. So you can give them tips about how to do fact checking and what are kind of red flags in some of these viral videos and posts that maybe they need to take it a step further and go talk to someone who they trust and who has accurate information to help them fact check with some of the posts. Lena, did you want to add to this?
Yeah, I think just a few things to also just to keep in mind is definitely we can't generalize across communities, but certain communities might have certain kind of cultural influencers that they typically go to or look towards for advice, information, things like that. So I would also just caution on also being careful on coming across to clients that you're also discrediting outlets that they typically go to, whether that's for comfort or for safety or for connection or for information. So when keeping that in mind and tying that into the points that Daniel and Sarah mentioned of kind of sifting through that there is a lot of information out there, some good and bad, especially with social media not always being vetted. Just also keep in mind that we also don't want clients to feel like we're also discrediting the usual outlets that they might comfortably go to, again, whether that's connection or information. So it's kind of showing and different outlets of those trusted, reputable sources, while also making sure that we also don't kind of reshare those same videos, like repeating that information, misinformation and disinformation, and finding that delicate balance of what clients typically go to as outlets and what are probably the best vetted sources of information, and being careful on social media on that front.
Wonderful. Thanks so much for all of those thoughts. So we have a few minutes left. Let's take a couple more questions before we wrap up. To the same thread around information and information that resonates with folks, here's a question saying, we work with recently arrived refugees and need to consider literacy levels for the diverse communities for these conversations. What efforts are being made to convert the information and conversation guides into plain language? And this also applies when explaining what agencies like the FDA are.
Yes, I'm very glad you asked that question. So for NRC RIM resources, such as the conversation guides that again are more for client-facing staff to then use when they're talking with clients, the way it works is we'll take the CDC guidance and we'll try to rewrite it in plainer, simpler language while keeping the main messaging intact. We then have our case managers and COVID champions who are bilingual, bicultural staff members. They will help us review this guide to see, first they help us figure out what questions clients are asking, and then they also look at the draft to see, are the responses, do they make sense and are they simple enough? Of course, there's always more work that can be done. So if you ever see something in a conversation guide that you feel is still too jargony or it doesn't resonate, like, you can feel free to let us know. And we also highly encourage staff to use these guides as a starting point, and then to feel free to tweak the language based on who you're speaking with and how you usually talk to make it feel more comfortable.
Wonderful. Thanks, Sarah. Another question here that we've gotten a lot. How do we talk to a pregnant woman about vaccine safety?
Yes, we've been hearing that a lot from clients as well, where they would get the vaccine, except they're either trying to get pregnant or they are pregnant and they're worried about the effects on their baby. What we say to them is what the CDC says, where the CDC has advised that it is safe for the vaccine to be given to pregnant women. If they are still concerned, again, I would direct them to their healthcare provider or someone else they trust to talk with them more about what are their concerns specifically related to their pregnancy. But you can emphasize again the main facts about the vaccine, that it's very safe, it's very closely monitored by the CDC. There have been millions of doses given to people of all different ethnicities, ages. Many of these people have been pregnant, and so they have not found any negative side effects being pregnant and having the vaccine. And so it is safe for pregnant women.